Hello and welcome to this podcast, Expert Voices in Clinical Aromatherapy. In this episode, Jacqui Stringer is with us. Jacqui is clinical and research lead at the Christie NHS Foundation Trust, and she's going to explain how she uses essential oils in her clinical practice in oncology. Jacqui explains how aromatherapy is used for resilience, for compliance, for management of symptoms, and for various side effects. She talks about her personal experience. Enjoy listening!
So in the UK, the place for complementary medicine is usually actually outside of, but working alongside, the care that's delivered within the NHS, and that's our National Health Service. So a perfect example of this would be that you would have a department within a hospital, and that most commonly would be in oncology or cancer care, and that would be run by a team of therapists, maybe with a healthcare professional with those extra qualifications working alongside them. A classic example, or a really good example of this, would be Emma Tyler and her team, who work out of the Dimbleby Centre in London. So they are actually a separate unit, but they work within the hospitals providing support for oncology patients, cancer patients. So the Christie Hospital in Manchester, which is where I deliver my clinical care, we use aromatherapy in different ways for our patients who are being treated primarily for cancer, their cancer diagnosis. I would say the first and possibly the most widespread reason for using aromatherapy is for enhancing resilience. And by that I mean giving patients the capacity to cope with what's happening to them. And in that situation, they are used as part of a package of care. Again, this is very similar to the work that Emma Tyler does down at the Dimbleby Centre, because we use the olfactory aspect, linking aroma to emotion to enhance well-being. And for that, we use aroma sticks. But then we might use additional techniques or tools, such as something called squeezy stars, smooth stones that people can hold, and we give patients techniques to anchor that relaxation into that particular prop. But another crucial way of using aromatherapy is to enhance compliance, and that's compliance often with life-giving treatment. So patients may be going through on a curative pathway, so that the treatment they're being given is potentially going to cure their cancer, but they actually cannot comply with it, they can't cope with it for various reasons. And a very common example is that they're having radiotherapy to their head, to their neck, and they have to wear a mask which locks them onto the plinth. And if they're claustrophobic or they're frightened, they can't cope. They won't have the treatment. So my team will use, again, the aroma sticks as one of a few tools, and to actually help them to keep control, to maintain, to gain back control of the situation. So then also we can use essential oils, and this is primarily where my own personal work comes in, where we would be using the essential oils for management of symptoms, for example. So some patients will respond to treatment, but there will be some cancer cells that are resistant to the treatment that it's given, and then they may end up with what we call a fungating wound, a malignant wound, which is where some of those cancer cells actually carry on growing, even though maybe some of it has responded to treatment, and it breaks through the surface of the skin, and they're left with a lesion that is not protected by the skin and by our immune cells within the skin. And so in effect what happens is that you get an overgrowth of bacteria. If these lesions grow really fast, then they will outgrow their blood supply, and they start to die off. So you end up with a lot of bacteria, you have damaged or dead tissue. You can imagine that smells. And you've also got the leakage, and it's a really, really sad space for that patient, because they will often, people think about them as being right at the end of life, but actually, if you've responded to the treatment primarily, it might be that you're living with this thing for a long time, and some of these people are young, breast cancer patients, maybe in their 30s and their 40s, and they've got young families. So by using the essential oils in topical products as part of that wound care, I can actually get rid of the odour. It takes the odour away, and we are working on identifying the various reasons for why that's the case. But we know that they do actually neutralise the odour, which is very different from masking it. And they also, because they're antimicrobial, they reduce the actual, what we call bacterial load in the wound. So there's less bacteria than there were, which also means then that you've got less exudate, less leakage. So there's a lot of things that we can do in that situation. And it empowers the patient then to go out and feel confident and be in social situations, whereas previously they would hide themselves away. There is also the management of side effects of treatment. So, for example, I'm thinking one that is probably best known is to support patients who have what we call chemotherapy-induced peripheral neuropathy. So you get this altered sensation. It might be pain, it might be numbness, tingling within hands and feet primarily, that come as a consequence of some of the chemotherapies. And we know that there are a number of essential oils that work specifically on these damaged neurons. And so, we've got various creams, topical creams, that we would use to help with that. I'd like to share with you one of my patients who was 23 years old, and she had 2 young children. One of them was 2, one of them was 3. She was very dynamic, she was very lively, and she'd had a nasal cancer, and they'd operated on her from within her nasal cavity. So from external, looking at her, she looked perfectly normal. There was no scarring. She was a lively, beautiful, fun young adult. But although the surgery was successful, the site of surgery wouldn't heal. And so she was referred to me after 6 months after surgery, and I asked her to share with me what her situation was. And the situation was that she was just clearly very distressed. She had to go in for what we call decrusting, surgical decrusting, which is that every 2 weeks the surgeon would put her back under local anaesthetic and remove all this damaged tissue from up her nose. There was no sign of healing from that. The smell was horrific for her. She came with her father. Her father just blatantly said, "She stinks," which is so sad, so her children wouldn't come near her. They wouldn't have cuddles with her. "Mummy, you stink." She couldn't go out with her friends anymore. She used to go out clubbing. She used to have a fun life. She was very withdrawn. So that was her situation. So I asked her what she was doing at the moment to help with that healing. And she said that the consultant had advised her to do nasal washouts with salt water 5 times a day. So that's what she was doing. So we said, okay, well, let's just continue with that. That's really good practice. All we're going to do is we're going to add at the end of each nasal washout, I want you to put 2 drops of this blend into some boiling water and inhale it. And obviously essential oil blend. And I'd like you to do that now while we're here so that I can make sure that you're tolerating it well. And she did it. She went into a different room. She came back and immediately it was like magic. And her dad said, "I can't smell you." So that was after 1 dose. So she went away and she did this at the end of each of her nasal washouts. She went back for her surgical decrusting. They decided she didn't need it. So she went back 6 weeks after that, and that was the first time they did it. They then put her on 6 weekly follow-ups. And ultimately, at that point, they said, no, you don't need it anymore. By then, I was having to actually rein her in to come and see me because she was busy being out with her friends and lively and fun. And we completely transformed that woman's life to be back to normal, you know. And by our children were loving her. It was like it never happened. It was this horrible part of her life. And that was out of 3 simple oils: geranium, palmarosa and lavender.
This was a podcast produced by the Gattefossé Foundation for Clinical Aromatherapy. Our next episode features Rhiannon Lewis, Director of the International Clinical Aromatherapy Network. She will explain the similarities and differences between international aromatherapy practices. Thank you for listening and come back soon!